Hey everyone, it's Jeff Young, kinesiologist, and this video is on neck health, more specifically neck health in a gym situation for people who suffer from joint pain in their cervical spine, but not to the point where they need physical therapy. So I'll go over some concepts and guidelines that are mostly common sense and will hopefully help you heal your neck pain if you have it, and especially not do anything in the gym that are going to make things worse. So with that said, let's go ahead and get started. The neck is in the safest position when the chin is retracted so that the head sits directly over the spine, which means there's no forward head posture, and it normally constitutes a standing or seated position. The chin is in a neutral position, which means the cervical spine is neither flexed nor extended. The scapula or shoulder blades are retracted, in other words, absent of sloped or forward shoulder posture. The head is supported and the chin is in a neutral position. In other words, the cervical spine is neither flexed nor extended. And the upper trapezius is as relaxed as possible during an exercise. When this happens, natural shoulder slope is maintained and no packing of the neck is occurring, and the neck is as relaxed as possible. Deviations from any of those five may place a person who suffers from neck conditions at a greater risk for injury or pain. With that in mind, examples of movements and exercises that may need to be avoided, at least initially, include reaching overhead because it increases the risk of contracting the upper trapezius or packing the neck, such as lat pull downs, pull ups, and overhead press. Forward torso lean with the head unsupported because it increases the risk of sloped shoulder and or forward head posture, such as with bent over rows or bent over reverse flies. And then exercises like suspension rows, crunches, sit ups, and planks. These exercises allow gravity to pull the head towards the ground, causing a more forceful contraction of the neck musculature and increases the risk that the neck will not be maintained in a neutral position. Examples of movements and exercises that place the neck at less risk for injury or pain include any standing or seated exercise where the chin remains in a neutral position, the chin is retracted, natural shoulder slope is maintained, and the neck is as relaxed as possible, such as with seated and standing rows, standing cable chest press, various seated or standing shoulder strengthening exercises, such as lateral raises and scaptions, various seated or standing reverse fly variations, such as cable reverse flies, any exercise where the head is supported, the chin is retracted, the chin remains in a neutral position, and the neck is as relaxed as possible, such as chest press on a bench or abdominal strengthening exercises lying on the floor, a table, or a mat, such as Pilates mat exercises. Therefore, if a person is experiencing neck discomfort during exercise, or just to avoid neck discomfort at all, the correctives to consider include make sure their chin is retracted or cue them to retract their chin, make sure their chin is in a neutral position or cue them to place their chin in a neutral position, make sure their scapula or shoulder blades are retracted or cue them to do it, make sure they're maintaining their natural shoulder slope throughout the movement or exercise or cue them to do it, make sure their neck is as relaxed as possible, or place their head in a supported position, such as on a mat or a bench, with their chin retracted and in neutral, their scapula retracted, natural shoulder slope, and relaxed neck. Also, many times I'll go through a simple process to teach my clients how to develop a better mind body connection with their neck. First, I'll have them stand against a wall and ask them to get their shoulders back, keep their chin in a neutral position, and retract their chin so that the back of their head is either against the wall or as close to being against the wall as possible. Then I'll have them protract their cervical spine or neck so that their chin moves directly forward in space. This is an easy movement for just about everyone. Once their chin is forward in space, I'll ask them to reverse the movement or retract their cervical spine to try to touch the back of their head against the wall again, and then repeat this movement for 2 or 3 sets of 8 repetitions. Once they feel comfortable with that movement, I'll put them in a quadruped position where gravity is now wanting to pull their head towards the ground and have them go through the same process. Since gravity is trying to pull their head towards the ground, it's a little more challenging because the neck muscles are having to contract more so than when they were standing up. I'll have them repeat this movement for 2 or 3 sets of 8 and then put them in a plank position and go through the same process. This is even more challenging because the neck and back muscles are contracting harder than they were when they were in a quadruped position. Finally, I'll have them form either a regular push up or a knee push up and cue them to keep their neck retracted the entire time, or I'll allow their head to hang for the first rep or two, but then cue them to retract their neck for the remaining repetitions. A lot of times I'll use the cue, retract your nose away from the ground, as my verbal cue. From that point on, if they have forward head posture, it's usually just a matter of cueing them to retract their nose or their chin, no matter what position their body's in. So, in conclusion, if yourself or your client suffers from neck issues, make sure you stick with exercises that don't place the head and neck in a position where gravity wants to pull them to the ground, which means choose exercises where the person is seated, standing, or their head is supported. Make sure they understand how to retract their chin properly to place their cervical spine in a neutral position. Avoid or limit exercises where reaching overhead occurs. Strengthen the upper back and rotator cuff. And make sure you improve flexibility in tight areas and get rid of trigger points through myofascial release. And then slowly begin to incorporate exercises that force the head and neck to fight gravity in order to strengthen the neck, such as crunches and reverse flies, but always terminate the set when the neck is starting to fatigue. And finally, you need to always have a mind body connection with the neck and try to keep it as relaxed as possible when performing any exercise. So I hope all that was clear. Let me know if you have any questions, and I'll see you in the next video.